Nosebleeds in summer are a common occurrence, especially in children. Quite often, even in adults, you tend to get nosebleeds. The cause of these bleeds is generally trauma to the anterior part of the nasal septum, which is actually occupied by a lot of blood vessels intermingling with themselves. How do you prevent these nosebleeds, which tend to occur in summer? So, the key is first, adequate hydration. Second is avoid any trauma to the external surface of the nose, especially avoid nose picking, which is quite a habit in children. So, children who tend to pick their noses, the parents have to take care to get rid of that habit. Most important thing, avoid going in harsh or direct sunlight. If you need to go out in harsh or direct sunlight, please carry an umbrella with you to cover yourself from the sun. Do not allow the children to play in harsh or direct sunlight. Another thing that you can do to avoid or basically manage the nosebleeds in children are keep an ice pack handy. For children who tend to suffer from nosebleeds, make sure that you know what is the first aid in case the child gets a nosebleed. So the first thing that you have to do is pinch the nose of the child and ask him to breathe through the mouth. Immediately apply an ice pack on the forehead to stop the bleed. Do not ask the child to gulp down whatever is bleeding, because in that case he will tend to vomit out the blood later on. Always maintain a position which is bending forward, not bending backwards, because if the child tends to bend backwards, then all the bleeding will go via the back of the nose into his throat, and he will tend to ingest it and he might vomit. So make sure that the position of the child is bending forward, pinching of the anterior part of the nose, and applying ice on the forehead and simultaneously breathing through the mouth. The pinching of the nose should be done for at least 7 to 10 minutes to stop the bleed. In case after such a maneuver the bleeding does not stop, you have to immediately take the child to an ENT doctor who might need to pack the nose.